As of December 2000, an estimated 340,000 people were living with HIV in the United States. In 2001, the CDC announced a plan to cut annual HIV infections in half by 2006. As HIV/AIDS deaths began to decrease in the U.S., the global crisis worsened, with sub-Saharan Africa being especially hard hit.
In 2019, I spent my summer in Ivory Coast, West Africa at an HIV/AIDS maternity clinic. They come in quarterly, every 3 months, depending on the person, and they get their blood drawn. We test all of their different levels to see their disease progression, and then they keep coming in and they get the medication that they need for free. So they get the antivirals provided to them for free, and they get, along with that, the counseling aspect, because it was a Christian clinic that I was working at.
In 2002, the FDA approved the first rapid HIV test, which provided results with 99.6% accuracy in as little as 20 minutes. President George W. Bush launched the United States President's Emergency Plan for AIDS Relief, or PEPFAR, to address the global AIDS crisis in 2003.
Ladies and gentlemen, seldom has history offered a greater opportunity to do so much for so many. We have confronted and will continue to confront HIV/AIDS in our own country. And to meet a severe and urgent crisis abroad, tonight I propose the Emergency Plan for AIDS Relief, a work of mercy beyond all current international efforts to help the people of Africa. This comprehensive plan will prevent 7 million new AIDS infections, treat at least 2 million people with life-extending drugs, and provide humane care for millions of people suffering from AIDS and for children orphaned by AIDS.
And that's probably one of the most important parts of the George W. Bush legacy, because that has saved now about 14 to 15 million lives thus far, and more coming, merely by providing sub-Saharan Africa and other developing countries with the proper drugs that can save their lives, as well as prevention.
I think the biggest thing it did was humanize the disease. These people are not statistics, they're not numbers. They are real people with real serious health issues. And at the clinic we saw families who had it, we saw children, we saw infants who had been born with it. So it's definitely not something that's dealt with, something that's far away, that's not a problem anymore. It's still a huge problem and a huge public health crisis still, both overseas and in the United States. A big component of that is awareness and getting rid of the stigmas so that people feel like they can get the help they need without being judged, without being pushed to the side. I think a lot of times, especially thinking about malaria, AIDS, any of the just really prevalent issues in Africa, we think, oh, these are poor people, they're just, that happens in Africa. And that's really not the case. While they have different financial situations from us, they're just full of so much joy. Every time I've just been loved on by these people, and I still have a huge place in my heart for the people who work at this clinic, the heart that they have for their community. And we just need to realize that while there are a lot of developing nations that have a lot more of these problems, every single person that is a statistic is a person first. It's not just this many thousand people in Africa have this disease, it's this person with this name, with this story, has this disease.
During his first year in office, President Barack Obama introduced a plan to reduce HIV incidence in the U.S. He also lifted the HIV travel and immigration ban that had been in place since 1987, which prohibited HIV-positive individuals from entering the country.
First goal, prevention. We can't afford to rely on any single prevention method alone. So our strategy promotes a comprehensive approach to reducing the number of new HIV infections, from expanded testing so people can learn their status, to education so people can curb risky behaviors, to drugs that can prevent a mother from transmitting a virus to her child.
I just want to say that you should always be tested for HIV. No matter what situation you're in, you may find that, you know, it's a burden off your mind just to know that you're HIV negative.
You know, when a person living with HIV/AIDS is treated as if she's done something wrong, when she's viewed as being somehow morally compromised, how can we expect her to get tested and disclose her diagnosis to others?
HIV and AIDS have been around for just a couple of decades, knowingly anyway. And while lots of people are aware and know about HIV and AIDS, they're really not thinking about how they can actually get it themselves or spread it to others. So that's why every time you have sex, especially with a new partner, you want to make sure that it is protected and to also make sure that you get yourself tested.
Here in Richland County, I think one of the major barriers for anybody living with HIV or having a health concern is access. Transportation, it plays a vital role of getting to appointments, understanding where pharmacies are, coordination of benefits, knowing that the medication is covered. Current state, there's generic versions of PrEP available for individuals to be prescribed. But having that knowledge, kind of going back to the health literacy and being informed or having informed choice about the decisions that you can make, I think is a huge barrier in our current healthcare system.
One of my areas of interest in healthcare is the study of health disparities and the social determinants of health that drive health outcomes. In terms of the HIV population, we are dealing with populations that are traditionally ostracized from the community as a whole. And as a result, they have less access to resources, or they are afraid to access the resources that are available to them because of fear of discrimination or persecution.
Robert Gamboa and Jose Velez work for the Harlem Prevention Center. It's part of an organization called ICAP out of Columbia University. Their job is reaching out to gay and bisexual men, encouraging HIV prevention, and inviting them to join the center's research.
Now, living with HIV doesn't mean that you just have HIV as your problem or your concern at the moment. And Third Street tries to answer that issue by providing other services that are pertinent to a well-balanced life, including dental services. What opportunities are available at Third Street, for example, to educate about PrEP and about HIV awareness? We have a navigator program at Third Street that works diligently to go into the community, discuss and educate our community partners about what is available at Third Street.
I get the amazing opportunity to work hand in hand with PrEP navigators who are skilled at all the education and support needs that they would have. So I can hand them off to work with the PrEP navigator, and then we work closely together, the PrEP navigators and myself, to make sure that the client's needs are completely met and that they become successful.
And at the end of the day, it's not just about PrEP, but it's about preventive care. You talk about some complications that may occur with a person who's living with HIV is usually that they don't die because of HIV. They die because of some other immune system deficiency.